Hi, this is the IHF team. We are a medical scientist, an engineer, and a healthcare technologist. This video discusses the IHF approach to red blood cell inventory analysis and optimization. What is the IHF approach for curating RBC inventory and what significant points have to be addressed? Let's discuss. Maintaining optimal blood supplies is challenging because recipients and donors have high phenotype variation. These difficulties are further amplified by the need to match patients to donors at multiple compatibility levels. The optimized blood bank inventory for patients with different compatibility requirements would reduce blood preparation centers' economic losses associated with disposing of unclaimed blood components. Additionally, it would minimize medical institutions' costs associated with patients' extended length of stay due to anticipation of compatible blood units. There are two ways that blood banks store RBC units: refrigerated and cryopreserved. Refrigerated RBC units have a 40-day expiration, whereas cryopreserved RBC units can be stored for 10 or more years. Cryopreserved RBCs are necessary when native RBCs with the required phenotypes are not available in the blood bank, and there is a lack of time to invite compatible donors. The donor phenotype classification (PUT) concept is introduced to assist in performing the blood bank RBC cryopreservation optimization task. Per the PUT concept, two phenotype usage type units are recommended to be cryopreserved: unique and extraordinary. For each unique PUT unit, the recommended standard of care is cryopreservation. The recommended standard of care is to have one or two RBC units of each extraordinary phenotype cryopreserved. Additionally, IHF Analytics determines for each donor the number of compatible patients who require extended phenotype matching and recommends certain RBCs for cryopreservation. Also, IHF Analytics identifies rare and extremely rare antigen combinations and flags donor phenotypes for additional review. As a result of the pilot project completed by the team, the IHF approach was proven to be effective. The IHF completed a pilot project at a European research laboratory. The system processed 3 months of operational data from the lab's specialized blood disorder medical unit. Pilot project data: 914 blood units were monitored, including 668 cryopreserved and 246 refrigerated. Donor phenotype distribution by classification category (PUT): Universal 76, required 103, unique 11, common 724, extraordinary 0, and no phenotypes with rare antigen combinations. Inventory analysis conclusion. First, 11 unique category units. 6 blood units classified as unique PUT were cryopreserved as recommended by IHF, green flags. 5 blood units also classified as unique were refrigerated, red flags, contradicting the IHF model, which recommends that these 5 unique units should have been cryopreserved. Second, identifying donors classified as required, universal, and common categories who have a greater or equal average number of compatible patients than the unique PUT average. This value is 9. IHF Analytics determined 12 donors satisfying the criterion for the number of compatible patients who require extended phenotype matching and recommended their RBC units for cryopreservation. 5 units are classified as required, and 6 classified as universal met the criterion for cryopreservation by having greater than or equal to 9 compatible patients. However, these units were all refrigerated. 1 blood unit classified as common PUT met the criteria for cryopreservation by having 10 compatible patients but was refrigerated. Finally, the last point: RBC units that were cryopreserved without meeting the criteria. 559 blood units of common PUT were placed in long-term storage without meeting the cryopreservation criteria. The IHF model prescribes that these units should have been refrigerated. IHF Inventory Analyzer helps optimize the blood bank's RBC inventory and curate cryopreserved RBC pool efficiently and effectively. Thanks for watching.